And thank you very much, Jill. And I want to thank Durcia, Samantha, Flora, and Nancy for sharing their research here at the 2020 KBHN virtual conference. And I'd like to thank the rest of today's speakers. We began the day with Senator Moody reminding us that we are all in this together, health professionals, researchers, and parents. Next, we had really quite a session on advancing navigation and lessons from the Kids Brain Health Network's integrated navigation support project. Melissa started us off with a mother's take on raising kids who have FASD and trying to navigate a system that looks like, never going to forget this one, an IKEA store. That's an image so apt, I don't think I'll ever be able to unthink it. She talked about gaps in navigation, especially with respect to mental health services, and especially the need to build resilience, not just in kids, but in caregivers as well. Amen to that. She talked about the perennial problem of kids aging out, of doors opening and doors closing. That seemed to be a running theme in the discussion. And I was reminded that my own son was lucky, fortunate, to get a final diagnosis of FASD with sentinel features as an 18-year-old by an experienced pediatrician who saw my son as a favor. So think about that one. We heard about navigation projects in BC, Alberta, and the Yukon, all attempts to simplify confusing care maps that are all too often leaving families to fend for themselves. We heard the value of taking a systems-based approach that helps us conceive of things in new ways. We heard about the value of peer support networks and parents networking with parents, that's something you don't want to take for granted. As Wenda Bradley said, relationships on the ground are crucial. We also heard that we need to take stock of local assets. Above all, navigation isn't just about simplifying the system or giving parents better navigation skills or recruiting and training better navigators. It's any and all of them, and one size does not fit all. After that, we had the inspiring Luke's Legacy Lecture, a memorial tribute to Luke Martins, a young man who inspired authenticity and excellence in family engagement and research. And as we know, sadly, Luke died in August, just a few weeks before his 14th birthday. Co-moderators Donna Thompson and Connie Putterman ably led a panel discussion that included Rachel Martins and Ali Martins, Jamie Lougheed-Winkler, and Francine Buchanan. Some of the things that I took from that session, I've already discussed some of them, but some of the ones I took, the Family Engagement and Research course is a brand new concept, and this is a real tour de force, the course that was created, and it illustrates a need to train parents and researchers to create a cohort of parents passionate about working with researchers, invested in engagement, and giving them the confidence to engage with researchers. And they talked about the graduates who are now on to bigger and better things, and the people who are taking the course right now. One of the things I took from the course curriculum was that a point that was emphasized is the importance of teaching about ethics, and also talking about barriers and facilitators of engagement, and the ultimate goal of building a community for family research partnerships, and of course, knowledge translation tools, which are so very important when you're talking about parents, family members who may or may not be up to speed on the lingo, as it were. Ali, Jamie, and Francine took the course as family members. Each team behaves differently. That was one of the thoughts that I heard from them. They said they liked hearing from researchers. They liked learning how researchers gather and use information. They liked hearing about the selection criteria for patients and families. In other words, they like to have a demystification of the whole research process and to know their rights and to be better able to connect with everybody on the research team. I heard very strongly that without this kind of training, there may be the lack of a bridge, and this kind of course builds a bridge between family members who want to be engaged and researchers who want to engage them. I also heard that life experiences pave the road for research, and I heard again and again the role of families that want to engage and not simply tell sad stories, as was said, not my words, but what was said in the panel, that don't necessarily add up into anything. Then we heard from Rachel. She talked about how do we build a village. partnerships in underwear. I'm not going to forget that one, Rachel, while giving Luke a nebulizer. And, that researchers must be convinced about the value of engagement of family members, and certainly, of course, like the one that was described by Donna and Connie, certainly do that. She also brought us back to Luke and his love of a particular song in the film Moana, and his ability to live in the moment, which is so important for us to remember, us parents who are constantly living in the worried future. Like, we're addicted to living in the worried future, and we have to be pulled back into the moment, because really all there are moments. The lightning round number 2, which was led ably by Dr. Jill Zwicker. We heard from Durcia and Samantha, Flora, and Nancy, talking about everything from spy-themed CBT to online training to music. And another thing that was not really a key part of Samantha's research, but she talked about percussion training. I have to tell you, there's not only percussion training of patients in certain neurodevelopmental disorders, there's also percussion training for health professionals. And I'm going to have a lot more to say about that in the next book that I intend to, that I'm writing right now. And that concludes my comments for today's brilliant day 2, and I want to thank everybody who participated today, and I'm looking forward to the rest of the course. But we invite you now to join us on GatherTown for virtual poster sessions. Our poster presenters have worked tirelessly over the last few weeks to polish their videos and posters just for you, and I know they would love nothing more than to interact with each and every conference delegate. There is a link there where you can access the platform, so grab your avatar, hop on GatherTown at 4:45 p.m. Eastern Time, that's 1:45 p.m. Pacific Time, and check out the poster walkthrough videos, followed by an in-depth discussion, poster presenters about their research. Yesterday's poster presenters were fantastic. I can't even begin to describe it. And today we have even more coming your way. Don't miss out on Brittany Finley's poster entitled Experiences of Caregivers and Youth in Accessing Government Disability Programs Across Canada. And check out Lauren Trafford's and Veronica Smith's poster on parent and child early coaching. That's PACE coaching for children at risk for autism. Can't wait to see those. I want to thank you. I want to thank once again our sponsors, Simon Fraser University, Claret, Azrieli Foundation, CanFASD, Holland Bloor Revere Kids Rehabilitation Hospital, Queen's University, CYMH, that's Ontario's Centre of Excellence for Child and Youth Mental Health, Gather, Family Support Institute of BC, and the Michael Smith Foundation for Health Research. Your support of this conference is essential. Just a reminder that tomorrow, November 11th, is, of course, Remembrance Day, and in respect of the day, KBHN will not be hosting the conference at all tomorrow. Just take a moment at 11 a.m., the 11th hour of the 11th day of the 11th month, to express a quiet moment of gratitude for those who have allowed us to live in freedom today and in the past, and hopefully in the future. But do join us back here on Thursday, November the 12th at 11 a.m. Eastern Time. That is 8 a.m. Pacific Time for the opening ceremony of Day 3, as we explore the sub-theme, Moving Online, Harnessing the Lessons of COVID-19. And there are many lessons to learn. I'll see you in GatherTown. Have a great rest of your day, and we will see you again on Thursday. Bye-bye now. I'm Brian Goldman.